In Invisalign, you don't have the wires and bands showing. It's much different than braces were, 15, 20 years ago, where you would eat something and the food would get caught in your braces and so forth. The Invisalign retainers, you actually take them out when you eat, put them right back in. It actually improves your oral hygiene. Most of our patients that do Invisalign find that their oral hygiene is much better because they remember when they take their Invisalign retainers out, oh, I need to brush. So we find not only does it help them have a great smile, but it also helps them remember to brush their teeth and floss, and we find our patients, their overall oral health is a lot better. Now, anybody can have Invisalign. If you're over 14 years old and you have your second molars in, you can have Invisalign. Now, of course, if you had some cavities in there, or you had some issues, they would have to be taken care of before you had the Invisalign, but that's just like traditional braces. Some of the other questions we get about Invisalign is, how long does it take? Invisalign will take the same amount of time as traditional braces. If you're going to be in traditional braces for 2 years, you're going to be in Invisalign for 2 years. So a misconception about Invisalign is that it's quicker. Some people think it takes longer. It's about the same cost and about the same time frame as traditional braces. The great thing about Invisalign is at the end of treatment, you get these Invisalign retainers. Remember the retainers from the 1980s where there was the big wire retainer you had to wear to bed? The Invisalign retainers are clear plastic retainers. They look just like the Invisalign aligner, and you just put them in at night, and you wear them at night, and you have to wear them at night or your teeth are going to go crooked again. Just like your orthodontist told you 20 years ago, if you didn't wear your retainer, your teeth would go crooked again. But the advantage to these is that they're clear and they're plastic. They're pretty innocuous. You just put them in and take them out. So patients seem to really like it. Invisalign has now come up with a retainer program where you can get 4 retainers sent to your house. You don't even have to go to the dental office. Invisalign will send them after your case is done. They will send you a retainer to your house every 3 months or every 6 months. As you can request, you can tell your dentist how often you want it sent. And you can have a new fresh retainer, because some patients were saying, well, look, I'm wearing my Invisalign retainer and it's getting a little old, it's getting a little discolored. I don't want to have to pay for a new one. So Invisalign has come up with a program that's included in the cost where you get a new retainer for every 6 months for 2 years. And then after that period, if you want a new one, of course, there's a small fee, which I think is a great program. So a lot of people will ask me, what do I need to do to get started with Invisalign? And it's really easy. You would come into the dentist, come see me, I'll take a look at your teeth, and if you're a candidate for Invisalign, which means if you're a candidate for braces, it's no big secret, then we take x-rays of your teeth, we take photographs of your teeth, we take impressions of your teeth, just like you're having a whitening tray, just upper and lower impressions, and we send all that information with my prescription telling Invisalign what we want to do to make your teeth straight. And in about 3 weeks, they send me back a email, and it shows me digitally how your teeth are going to become straight and how long it's going to take. And you can actually watch the video with me on the internet. It's pretty interesting. And then if everything goes well, order your aligners, and you come in and get them. So you just come in for the impressions, x-rays, and photographs, and then your next visit, you pick up your aligners. And every time you come in, I give you 3 sets of aligners. You wear the first set for 2 weeks, take them out, then you wear the second set. Take them out, you wear the third set. So it's really easy to, Invisalign numbers them, because a lot of people can get confused. Aligner 1, aligner 2, aligner 3, and it just goes all the way through how many aligners you need. Some people need 12 aligners, some people need 16 aligners, some people need 20. It just depends on how crooked your teeth are and how long it's going to take to complete the case. So you don't have to come into my office every 2 weeks. You come in every 6 weeks because I give you 3 sets of aligners. And if you have any problems, you can give me a call, but it's really straightforward.